So we know that we've had 12 million jabs given out so far in the country's vaccination drive, and government is hoping to pick up the pace more and more. But of course there's worries about a new variant on the horizon. Let's discuss all of this now with Professor Mosa Moshabela, Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. Prof, thank you so much for joining us. I want to start with the NICD. They've issued a new directive around giving the jab to pregnant and breastfeeding women. We've known for a while that if you're pregnant, you can safely have the jab, but the category has changed just a little. Tell us more.
Yeah, indeed. Greetings, Sal, and to the viewers. Yeah, we also received a memo from the Department of Health that basically said that, there's a shift from the previous policy guidance that pregnant women can get the jab only from their 14 weeks of pregnancy. That means after they've completed the first trimester, to say that they can now get the jab at any stage of their pregnancy. And this is really important. It's significant. There was a lot of scientific lobbying behind the scenes because of the concerns that have been picked up that a lot of pregnant women have been dying from COVID-19 because they were being sidelined from the vaccination program. And these issues emerged even during the Sisonke period, where pregnant women were initially not even allowed to get any jabs. So this is a tremendous progress in this regard. And this will, of course, include lactating mothers. There's also data that confirms that there's no evidence of risk even in terms of fertility. So as far as reproduction is concerned, pregnancy and lactation, the jabs that we have are considered safe at this point.
So it's the phrase that you've tacked onto the end there, the "at this point," that I think scares people who are hesitant. I wonder if you could just comprehensively address this rumour, this conspiracy theory going around, but nevertheless it has enormous power to frighten people, that the jab is going to make you infertile. Do you have any understanding where rumours like this come from? And what is the best way to reassure someone who's heard this and is frightened?
Yeah, no, I think that it will depend indeed in terms of where those rumors come from and what the theory is behind it. I think that in the South African context, there was initially, as I said, under Sisonke, caution about use of jabs in pregnancy. And that caution, of course, was taken to mean that the jabs may not be safe for conception or for the baby and so forth. But that was because we were early in the clinical trials, and usually with any clinical trial, we try and do them in people who are healthy, and that would exclude pregnant women, and that would exclude children as well. It's only as the trials proceed and they're established in people who are adult and healthy that they then begin to include other special groups. So subsequently, these groups have been included, and the safety in those groups have now been established, which is why the guidelines have shifted. But I've seen a lot of stuff, of course, that is unfounded about blocking tubes, about this, about that, having to do with pregnancy, but that is all, myths and rumors that I don't want to give any light to. I do think that in the South African context, the initial concern around use of jabs in pregnancy was an important determinant of people's attitudes towards jabs in pregnancy and lactation. But we have overcome those now.
I want to ask you about the concerns that the unvaccinated are the ones who are going to ultimately drive any new variants. And I ask this because there is a new variant on the horizon. It's still being closely watched. Do you agree that if we do not vaccinate a significant proportion of our population, the unvaccinated are the ones who are going to be incubators for any new variants?
Sally, you would know that the way things are said and the way words are used, I take it seriously. It's really important. And I don't agree with that statement in the way that it's conveyed. Mm-hmm. Because if you look at it, it seems to imply that then you need to blame people who are who are not vaccinated, and I don't think that's fair. Because then there can be a lot of people who are not vaccinated who would take precautions, and some of them may actually have their own valid reasons, and that they should not, they wouldn't deserve this. I do think that there is an sense of agency in terms of encouraging people to vaccinate, but the blame game is not going to help. Here's the thing: the virus will mutate anyway. That's the first thing, and we can't blame people who are not vaccinated for that. The second thing is that when viruses are harbored by people with low immunity or immune suppression, they can stay longer in those people, or as we call them from an epidemiological point of view, in those hosts. And as they stay longer for months, they can continue to replicate, and in replicating, they will mutate. And that has been demonstrated as well. And also, if epidemiologically in the population, we don't control the surges, we don't bring surges of infections under control, and the disease continue to spread, then we are going to find that virus will replicate, and as they replicate, they will mutate. And so these are the things that we have to consider first and foremost before we start to point fingers. I do think that there is recognition that the more people vaccinate, we then reduce the chances of the virus to spread. And then we limit the chances of the viruses replicating and mutating. That is the language that we need to recognize, not necessarily the blame game kind of language.
Now, I think you make such an important point. Blaming and shaming not only is unfair, but also it tends to make people harden their position and it polarizes the matter, and that is the last thing we need. I want to just speak to you about the latest COVID numbers coming through to us this evening. Over 7,000 new cases. Leading the provinces is KwaZulu-Natal, 1,803, followed by the Eastern Cape, 1,585, and then the Western Cape at 1,220. And tragically, the death's still really high, 431. Now, I know that we have to look at this over a 7-day rolling average. But what's interesting is the positivity rate, which has dropped quite a lot, is at 14.4%. Do you think that could be any indication that we might at last be getting through this third wave that has just stayed with us far too long?
Well, yeah, I mean, absolutely. I think that it's a promising signs. Yesterday, the positivity rate was about 17%. The cases were about 5,000. We know Mondays they tend to drop, but we are beginning to see a downward trend in positivity rates. We are beginning to see a downward trend also in certain provinces, Western Cape, KZN a little bit. Things are promising. And I do think that, of course, the Eastern Cape is behind KZN. We do need to just make sure that we as you say, we monitor it over a slightly longer period of time, over 7 days, over 2 weeks, just to make sure that it's a downward trend. But otherwise, the signs are promising, and I would say that, we do need to be optimistic and continue to encourage people to do what is happening currently in terms of prevention measures to discourage the continued spread of infections. So, yes, indeed.
All right. Well, thank you so much for chatting to us. Professor Mosa Moshabela, Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. Thank you very much, as always, for your time.